I'm a homeopath. I've been working now for about 20 years. I'm a fourth generation homeopath. My great grandfather brought homeopathy into the practice in about 1915 in a small town called Mihijam, which is now in Jharkhand. You see some pictures of the original family clinic behind me. My father's been in practice now for 50 years. The clinic in Delhi is about 48 years old. This is a new endeavor based on repeated requests of our patients who used to fly up to Bangalore. Sometimes they used to fly us down because of a lacunae of good homeopathy or reliable homeopathic practices where difficult cases were treated or managed on a regular basis. So we decided to open up a clinic to meet that demand. Coming to diabetes and homeopathy, diabetes, as you know, is almost at pandemic levels in India and all over the world. The WHO estimated that the jump of diabetes in the global population has been from 7% in the 1990s to now 14%. So in the last 35 odd years, there's been a doubling of the rate of incidence of diabetes in the global population. India, unfortunately, is leading the charge. We are on track to get about 70 million diabetes patients in the country this year. It is also one of the leading causes of death, leading causes of stroke, leading causes of cardiac events. All of these, unfortunately, are also very rampant in India. We know that chronic illnesses develop from diabetes. We know kidneys are affected. A lot of these conditions are irreversible according to allopathic medicines and options, which is why we actually see quite a lot of these, because when options are limited, people start looking for alternatives. And our clinic and our practice has garnered a reputation of managing a lot of these very complicated conditions. So not only do we have a big chunk of early diagnosis, early stage diabetics, but also late stage diabetics with all the complications of kidneys, nerves, eyes, and other issues. Sometimes we see quite a lot of gangrene cases. Diabetic foot is what it's called, and unfortunately the only solution is amputation of the limb. So we've managed to save quite a few people from getting their limbs amputated, which is a very, very big thing. Very difficult. I would say about 35% or so of patients who come to us at the stage of amputation have had a very good response. Those who come to us at early stages of gangrene where amputation has not yet been advised, the percentage might actually be even higher. Another very important aspect is that people who are already diagnosed as diabetics or who have been on conventional allopathic medication, it's not something that homeopathy doesn't have to be introduced at the cost of allopathy. We see quite a lot of people who are having trouble controlling their blood sugar, even with insulin or oral hypoglycemic agents. And adding homeopathy on can be done first of all very safely and can really improve outcomes, really improve their blood sugar level management. So it has that role as well. So at early stage, we, in conjunction with very aggressive lifestyle, diet, exercise changes, homeopathy alone does a very good job. People who have already been on allopathic medication should also consider homeopathy because it can safely be added on. There are patients who we are able to wean off allopathy also over time, provided there has been good lifestyle changes. And those who are struggling with complications, the sequelae of diabetes, like I said, chronic kidney disease, diabetic nephropathy, diabetic retinopathy, where vision starts getting affected. There's a very painful process of getting injections into your eyes every so often as a result of these issues. All those patients also see a huge benefit. We have analyses of our own patients done a few years ago where chronic kidney disease, over 55% of patients reported an improvement in their creatinine and urea readings, which is amazing, which is phenomenal because allopathy is not able to do anything. These are patients who are basically on the path to continuous dialysis or transplant. So in all these, in the whole spectrum of disease and severity of diabetes, homeopathy has a role to play in each category of patient. Obviously, claims of magical cures and all are not to be made, but improving quality of life, reducing complications, prolonging life, avoiding things like dialysis, these are huge benefits to patients of diabetes that homeopathy can offer. And it should definitely be considered as an option by all diabetics. Diabetes has reached pandemic levels all over the world, with about 14% of the global population suffering from it. We are on track in India to get about 70 million patients this year. It's very, very important that we try and turn this tide. We improve our blood sugar control across population and improve lifestyle, diet, and introduce exercise into our daily regimen. Homeopathy has a very important role to play in all categories of diabetics, whether early stage, where reversal may also be hoped for, in properly diagnosed, established cases who are already on hypoglycemics. Homeopathy can help in reducing the requirement of conventional medicine. Even in advanced cases which are not responding to conventional medication, and in complications where you have things like diabetic nephropathy, diabetic retinopathy, and neuropathy, for example. In all of these conditions, homeopathy can provide some benefit to patients. Therefore, homeopathy should be considered as an important option for diabetes management.